All right, welcome back into Twin Cities Live. So October is Breast Cancer Awareness Month. Now here's a concerning stat. It's the second leading cause of cancer death among women in the United States.
So for women who have gone through a successful lumpectomy, the latest technology can help fast forward radiation, so it can make your appointments as short as 10 minutes. Wow. This is fascinating. This is our Thrive with Twin Cities Live segment today, and Dr. Ryan Youland from Minnesota Oncology is joining us here with more. It's so nice to have you here.
Thank you for having me.
I have to ask too, when it came to, every doctor has an interesting story about how they came to this specialty. What was it about this that you really wanted to focus on with women?
So my background is actually in engineering, and that naturally led to radiation oncology because we work with a lot of technology and physicists.
So you were the smartest guy in your school. 100%.
I like how he said, and naturally.
Just naturally.
And just naturally.
I'm like, I wouldn't know that would naturally lead to the next thing.
Yeah, but it is a lot of science. So it's in your brain works in a certain way. So let's talk about the thing I love about all the, we raise so much money and so much awareness for cancer and all the things. There's always new advancements happening all the time, some of which we don't even know about. Like this one. This is the fast forward breast radiation therapy. What is this and what's so special about this new technology?
So the fast forward breast radiation really all starts with a consultation with a radiation oncologist. So during that appointment, the radiation oncologist would evaluate the patient to see if breast radiation is warranted, and if so, what kind. Mm-hmm. From there, if a course of radiation is agreed upon, then we need to map it out. So the best way to map out a radiation treatment plan is to do a high-resolution CT scan through the area of interest. In this case, it'd be through the breast and surrounding organs, most critically the heart and lungs. And then from there, there's a whole treatment process involving a lot of different people behind the scenes. So the process involves radiation dosimetrists whose job it is to come up with the technical aspects of the treatment, the beam energies and angles, and that physics I was talking about.
Yeah.
We also work with medical physicists who help us take our computer model of what we expect to happen, with the radiation that we expect to deliver, and translate that to the real world. So there's a lot of calibration and quality assurance involved. Then once treatment is underway, it's really quite simple. So it's a 10 to 15-minute process overseen by radiation therapists. And most of that time is really just getting the patient in the exact right position for treatment. The beam is really only on about 3 to 5 minutes per day.
Okay, so I got to ask a really basic question. So then the goal of radiation is specifically what? I mean, I know it's to get rid of the cancer, but like what is it specifically doing?
So we find that even after surgery looks successful, even for early stage breast cancer, the risk of relapse is still higher than we'd like. And so the goal of radiation is to kill any remaining cancer cells left behind. So cancer cells are inherently more sensitive to ionizing radiation than your normal tissues.
Oh, they are.
And so we exploit that difference.
So they're strong, but they're weak.
Yes.
Okay, all right, I like this.
So pretty quick procedure, this radiation therapy. So obviously we know what the benefits are. You're killing the cancer cells and everything on the margins that maybe you couldn't see. So what are there any potential side effects to this type of treatment?
So there can be side effects, not immediately. So the radiation is given and then the patient goes about their day. But over time, there can be fatigue, and in the setting of breast cancer, it's more skin changes that we see. So the skin changes can range from kind of mild irritation, like a sunburn sort of reaction, all the way to something more severe, like blistering. Fortunately, with shorter and shorter courses of radiation that are delivered even more precisely, pretty much each year, we find that the skin reaction tends to be significantly less.
So at Minnesota Oncology, I mean, this is the focus. Cancer is the focus. So how often are you able to take advantage of the advancements in technology? And what are the things that you're most excited about that you see coming out?
So I think there's two major advancements in the technology that I'm most excited about as it pertains to breast cancer. One would be the advent of this fast-forward radiation. So this came out of the UK. It was basically a 1 to 2 week course of radiation, giving a full course of radiation to the breast in what used to take 5 to 7 weeks.
Wow.
And with the longer courses of radiation, it didn't work any better. It worked the same as the 1 week course of radiation. And yet we see less side effects with the short course, and less side effects in the short term, and very similar late effects, which are fortunately very rare. Another major push has been trying to limit the amount of radiation that we give.
Yeah.
And so for select women with really favorable early stage breast cancer, we don't need to treat the entire breast, rather we can treat just the lumpectomy cavity.
That's amazing.
Yeah, and so when we just treat the lumpectomy cavity, you can imagine you're shrinking the volume, so obviously the side effects would be significantly less.
Yeah.
Right. So then who is all sort of eligible for this new procedure and new technique? Is it everybody, or do you have to meet like a certain checklist and criteria to go to that phase?
There are checklists and there are nuances. So the radiation oncologist would go through the pathology report and see how the surgery went. Overall, it's mostly women with stage 1 breast cancer who underwent lumpectomy, so a wide excision of their tumor, where the tumor was removed completely. I'd say most women have also undergone a lymph node assessment to make sure that the cancer has not spread to the lymph nodes, and they are indeed stage 1.
Well, and when you talk about that stage 1, that early detection, how important it is for women to know their bodies, to go through the testing, and then to just make sure that you're getting to the pros when you are looking for your treatment option. And you are so helpful. This was really great information. Thank you so much.
Thank you.
Yeah, thank you so much. Yeah, that was great stuff.
Okay, so Minnesota Oncology is the Twin Cities' largest and only independent cancer care provider. They have more than 100 providers at 14 clinics. They have new locations in Maple Grove and Hudson, and they do kind of speak a language that I only understand about 25%. I feel really confident
and
about
they keep growing and growing. They expanded their
Great.
team with 2 new breast surgeons as well. You can learn more on mnoncology.com.